I would like to invite Dr. Kirti Udayai, Associate Professor and Associate Dean, IIHMR Bangalore, to say a few words to all the students here and to the rest of us. Welcome.
Thank you, Doctor. So good evening and namaste to everyone. So how many of you want to become doctor? You are listening to great doctors since morning. Raise your hand. No one? You don't want to become doctors? Okay. So how many of you want to become the change maker for West Bengal? No one? Then I heard a pressing question in the morning that one of the students asked, that why we had so much of things earlier in West Bengal, for example, the first pharmaceutical company, but why we are not progressing at this point of time. So don't you want to know the answer of that question? If you are not raising the hand for be the next change maker? No. Okay. Then let me ask other way around. Do you know Rabindranath Tagore? He's from which state? Which state? West Bengal. With full enthusiasm you should speak. He's from which state? Do you know Jagdish Chandra Bose? He's from which state? West Bengal. One more important point. Do you know which state is the highest producer of rice, wheat, pineapple, vegetables, tea in India? West Bengal. And still you think that you cannot make the difference? Yes or no? Can you make the difference? So the point is, I would like to address the point of the student who has asked one question in the morning, that it is not the state or the resources of state which makes the difference. It is the people of the state who makes the difference. And you can be the next Rabindranath Tagore, you can be the next Jagdish Chandra Bose, but you should have that attitude to make the difference, right? So have you ever thought of that I can be the next Mahatma Gandhi? Have you ever thought of that I can be the next Jagdish Chandra Bose? So this is just an intro, but moving ahead, the topic shared with me to share and connect education, technology, innovation, and skills. And since morning, we have heard from many stalwart clinicians, medical professionals, and the healthcare leaders and their journey towards the progress of West Bengal. But I would like to pick up the point of Dr. Rupali Basu and Dr. Alok Roy. And they have said that need is something which leads to development. And they have mentioned there is a need of technology, there is a need of infrastructure. Above all, there is a need of professionals, paramedics, what we have learned. But in my opinion, there is a need of integration. There is no scarcity of resources, whether it is manpower resource or any other resource in any of the state of India. But there is a need of integration in terms of management. So I would like to ask one question again from the industry leaders sitting on the dais and off the dais. Do you think problem-solving ability and decision-making ability is one of the most important management skills? Yes or no? No? Do you think communication ability is the important management skills? Yes or no? And last but not the least, do you think strengthening of mind and body in context of self-awareness, self-control, and self-motivation is the most important management skills? Absolutely yes. Given a chance, you will say all three skills are important. But I have raised that point differently. Because these skills inculcated among ourselves with experience, with practice, and with development of leadership ability. So leadership is a continuous development process. And we have to upgrade ourselves among these skills so that we can cope up with the changing environment. In the era of healthcare 4.0, in addition to communication ability, decision-making ability, as well as the self-management. The another skill which is need of an hour is the digital skills. Do you agree? Digital skills is required presently. We have seen the presentation of Dr. Sen, and he has presented a full slide on AI, digital initiatives, and Dr. Supten Sarvadikari and other stalwarts sitting on the dais. They have mentioned that digital skills is important. But the question is, are we following the digital skills and inculcating among ourselves? And why it is important? As of now, the healthcare industry, not only of West Bengal, but also of India, is in the mid of digital divide, where 50% of the professionals are possessed with the digital skills, and 50% of the professionals are in the process of developing the digital skills. But at this point of time, to become the change maker, to become the policy maker, as well as to create a new platform and benchmark, digital skills is important in the leadership ability. The point is, why digital skills are important? The first is, there is a steep increase in the use of internet, artificial intelligence, use of health devices, wearables, and so on. So if we do not match our skills with the changing environment, we will not be able to set the benchmarks. The most important reason for which I appreciate and admire to gain the digital skills is the changing patient behavior. And at present, the way of connecting with the patient is digitally connect. Do you agree? Patient follow reviews, patient follow information, patient follow even appropriate action based on the digital information. And if you won't able to get the digitally connect skills, you cannot able to connect with your patient and never able to convey your message in a right way. So that is another pressing requirement which leads for the generate and learn the digital skills. The third important point to learn the digital skills is handling information. Gone are those days when we relies on the informal communication and some sort of market research. Now we big time realize on data-driven approach. Whatever data says, we rely in terms of handling the information and taking the appropriate strategies accordingly. So in that note, again, digital skills is important to learn the data analytics management. And last but not the least, which is very, very important, innovation and creativity is the survival mantra in the business. If you can't innovate, if you can't create, you cannot survive in the longer run. And technology gives a platform act as a tutor to develop and create. It gives and stimulates the high order thinking, and it also helps in collaborative research in terms of creation and development. So to build up the innovation and technology, it is important for us to learn the digital skills. But now the question comes, you must be thinking that why I am talking on digital skills, on creativity and innovation, when I'm supposed to speak on the industry academia linkage, because as an associate professor and associate dean of IIHMR Bangalore, it is important for me to highlight the integration part of industry and academics. And this can be possible with the help of bringing all the stakeholders at one platform. And how we can do that? With innovative pedagogy. Now, the question comes, what do you mean by digital-related innovative pedagogy? And the answers are digital-based games, simulation-based exercise, which can give a platform for experiential learning. We can also work on real-time assessment focused on skill-based assessment. And we can create a plethora of e-resources which can not only help in terms of enhancing the knowledge, but also enhancing the skills of the students. And this can give a real boost. So we have so many paramedic students available in this forum today. But the point is, until and unless you take a step ahead, you learn something new, which is need of an hour. You change your attitude as per the change in the requirement of the industry. You cannot set the benchmark. And to create a Siliguri, a medical hub, it is important for all the paramedic students to learn the new ability, new skills, which can make you industry ready as well as job ready. If you are competent, there is no question of salary and growth and development. But the point is how to make yourself competent. We have also observed that there are a lot of brain drain from West Bengal. And since morning, we talk about that we should follow the steps of Kerala, Hyderabad, and Bangalore. But I would like to conclude, and I would like to say that we should not follow the West Bengal. Somehow I am not from West Bengal, but I have a deeper connect with the state. We should not follow Hyderabad and Bangalore. The Hyderabad and Bangalore should follow the medical hub of Siliguri, which we are projecting. Yes or no? Are you excited for this? So I would like to conclude by saying that be the change maker, not the complaint maker. Because one person, one Mahatma, one Kalam, one Rabindranath Tagore can make the difference of the present time. So inculcate the digital skills, inculcate the management skills, and definitely we have the world's best clinicians and medical professionals in the state. Integrating and working together, I think we can create the world's best medical hub at Siliguri, West Bengal. Thank you.